My name is Laura Parmley, and today I'll be talking about attention deficit hyperactivity disorder. For my introduction, my quirkiness is that I'm a 19-year-old girl who is already seen as a crazy cat lady. I'm obsessed with cats. I've grown up with cats all my life, and currently I'm a dedicated cat mom to 11-month-old Alfred Binks Parmley. And fun fact, I can turn myself into a human pretzel. Something that I absolutely cannot stand are feet. If they're covered, that's fine, but if they're out in their full glory and they're too close to me, or I have to touch them, or I just don't like how they look, then I am leaving the room. Attention deficit hyperactivity disorder, also known as ADHD, is a disorder that is marked by the inability to focus attention or overactive and impulsive behavior, or both of those two things. ADHD is a neurodevelopment disorder, and a neurodevelopment disorder are a group of disabilities in the functioning of the brain that emerge at birth or during very early childhood and affect a person's behavior, memory, concentration, and/or the ability to learn. These disabilities could include ADHD, autism spectrum disorder, and also intellectual disability. The DSM-5 defines ADHD as a persistent pattern of inattention and/or hyperactivity impulsivity that interferes with functioning or development. In the following slide, there will be a video that plays that hits the high points of ADHD, and then I will go on to elaborate what that video addresses. In that video, it mentioned that millions of children suffer from ADHD. And a fun fact that I found is that 70% of children who display ADHD are boys. Next in the video, it addressed the different types of ADHD and their symptoms. I am only talking about two types, inattention and hyperactivity impulsivity. With the symptoms of inattention, the child is often disorganized, they make frequent careless errors, it's hard for them to attend to details and to pay attention and listen to others, they're easily distracted, it's hard for them to follow instructions closely and to maintain concentration on one task and finish it through. You may find them turning from one task to another one without completing it because it's hard for them to concentrate on just that one thing and to complete it to the end. Symptoms of hyperactivity and impulsivity are frequent fidgeting, tapping of the hands, legs or feet, the inability to play quietly or to stay seated for a long period of time. They may talk out of turn, and they may interrupt in conversations at inappropriate times. To be correctly diagnosed with ADHD, these symptoms should persist for 6 months or more. These symptoms are shown before the age of 12, and they are shown in more than one setting with the individual experiencing this impaired functioning. So ADHD does have effects on children, and some of these effects are it may be very difficult for them to concentrate and remain seated during school. A child with ADHD could experience more accidents or be seen as clumsier than the children that are around them. It's not uncommon for children with ADHD to experience anxiety or mood problems. And also, children with ADHD can also continue this up into their adulthood and be affected by this disorder. Some causes of ADHD would be mainly biological factors, but also sociocultural factors that can increase the effect that ADHD may have. So biological factors address the abnormal activity of the neurotransmitter dopamine and also the abnormal functioning of the frontal striatal regions of the brain. And those regions include motor, cognitive, and behavioral functioning within the brain. Also, high levels of stress and dysfunctioning within the home, as the video addressed, can also lead to affecting and increasing the effect of ADHD. The sociocultural factors are the simple diagnosis of ADHD can increase the effect of the disorder. So, for example, children who are very hyperactive, they can be viewed down upon or viewed negatively by their teachers and their friends, the people around them, which can cause them to see themselves negatively. And so it's increasing this effect of the ADHD. Two treatments of ADHD are drug therapy and behavioral therapy. Drug therapy includes the drug methylphenidate, which is a stimulant drug that's known better by its trade name, Ritalin. This drug can help children focus, solve difficult tasks with multiple parts, control aggression related to ADHD, and it can also help the children remain calm. Some side effects of this drug include the normal side effects of most drugs, which is insomnia, headaches, nausea, and decrease in appetite. Some of the more rare side effects are developing mild tics, tremors, psychotic symptoms, and those that have a previous history of cardiac issues could be at risk of a heart attack. Like I said, those symptoms are very rare, but there have been reports of those things happening. Many children also are known to take breaks from this medication because This drug can also have an effect on their growth if they're taking it at a very young age, so they have holiday breaks from this drug. The use of this drug has increased greatly because of the overdiagnosis of ADHD in this day and time, with many children who are seen as hyperactive, but really they are hyperactive, but it's not a correct diagnosis of ADHD. Another therapy for this is behavioral therapy, and this includes operant conditioning, where a child would be rewarded by a parent or a teacher for being attentive, for concentrating for a long period of time, maintaining self-control, or completing a task to the very end. The best way to treat ADHD, though, is to combine behavior and drug therapy. By combining the two treatments, you can lower the medication dosage, which can help avoid any rare side effects or the more severe side effects, such as stunting the child's growth at a young age. It can help avoid those side effects by combining both of these therapies together.